Brendan Brown, Chief Nurse, Burton Hospitals.
This is Magnus Harrison, Executive Medical Director at Burton Hospitals.
We're here today to just have a conversation with you really about the work that we're doing with Derby Teaching Hospitals Foundation Trust. Derby are going to be, over the next few years, one of our major partners, and if you can all remember our plan on our page, one of the golden threads that runs through the whole plan on a page document is our partnership working, and Derby will be one of our main partners.
I think there's a lot of uncertainty in the organisation, which is probably reflective of where the NHS is sitting currently. But it's important for people to remember that we've been working with Derby for many years, and we've had several successful collaborations which are still in place. And if you think about the work that we've done around our cancer services and, for instance, our renal services, we've got a proven track record of working very closely with one of our neighbouring trusts.
So we had a clinical summit on Friday of last week where senior clinical leaders from Derby and senior clinical leaders from Burton all met. There must have been probably between 80 and 100 people in the room. I think the most noticeable thing for me was how much energy and enthusiasm there was. Clinicians talking to clinicians across hospital boundaries quite freely. Finished up with a number of actions which Brendan's now going to tell you about.
So I think to Magnus's point, there was a real energy in the room. It was a room full of our medics, our surgeons, nurses, midwives, allied health professionals, and bringing those two groups of people together, as I said, as Magnus has alluded to, really did provide an energy. I think we summed it up into three distinct categories. There was a real sense of camaraderie, there was a real sense of challenge, and that challenge was about why are we doing things in the way that we're doing? Can we do it differently? Can we improve the experience for patients by doing it differently? And can we challenge the norm? The third thing was a real sense of commitment that whilst, and I think both of us are very realistic to the sense of uncertainty in both organisations, there was a commitment to working together, as I've said, as we already have been, but working together very differently and in a much more positive way going forward. What we really want to move on from is the geographical boundaries that's set up in the healthcare economy that we work in. Derby and Burton are 11 miles apart. What we want to do is work differently and smarter together.
And I think we probably just need to mention the P word, the partnership word, which I think probably causes quite a lot of nervousness for quite a lot of staff in the hospital. And I can understand why, because it's really difficult to describe what partnership means and where partnership might lead. For us at the moment, it's a clinical partnership and it's doing better things for the patients that we represent as the senior leaders in the hospital, in the trust. It's really important that we don't, I suppose, feel frightened in a way, and we just let the clinical pathways develop, and as they develop we'll be more clear about what the future actually holds.
So going forward there will be more of these summits. As the work progresses we will be sharing that with you and your teams. The people who are at the summits, the clinical leaders of both organisations will be sharing that with you. And if you have a view of either wanting to join one of the summits or to share information that we should be discussing within those forums, please either let us know or your divisional management team, because they'll be able to take your ideas forward.
And if you just want to talk and you see us walking around the hospital, just collar us. We'll both talk to you quite freely about what's going on to allay any fears that you might have.
Thank you for listening.
Thank you.